Catherine, thank you for that brilliant presentation on this bill. Bill 235, Speaker, Support for Seniors and Caregivers Act, is a supportable bill. Speaker, it's supportable because it's an example of the government stealing the Ontario NDP's homework. We submitted these amendments to a bill 3 years ago in 2021. The government voted those amendments down, and lo and behold, look what happens. It's now materialized here today. Most of the bill is comprised of those amendments, and we are glad that the government is now seeing the light, that they now want to do what we proposed 3 years ago. But this bill could also go further, as we know that long-term care homes are in need of funding. They're in need of support so that they can deliver the quality of care that our seniors deserve, and that is expected for all our loved ones. The fact that this bill is now being rushed through and the government simply could have tabled it earlier, done proper consultation, and still passed it by the end of this year is insulting, because once again, when it comes to time-allocated bills, we don't go back to the public. We also recognize, Speaker, that there has to be strong penalties when a long-term care home fails to maintain proper records, which is what we saw during the COVID pandemic when the government just simply stopped inspecting those homes. We saw extraordinary pain and suffering in those homes, and we saw for-profit facilities and operators get away with literally social murder. The government actually, by creating more penalties for bad record keeping of long-term care operators, is actually a good thing, but the government should take its own advice, because they themselves have failed to produce records of meetings, text messages, and emails about large infrastructure projects, and that has caused a lot of concern when it comes to public and accountability, and it deserves further scrutiny, which is probably why the Integrity Commissioner is involved with those discussions. Schedule 1 of this bill amends the Fixing Long-Term Care Act 2021, and it actually requires now dementia care programs and services for residents. This change, Speaker, is long overdue. It's actually insulting that it's actually come so late, but Speaker, it's here now, and we're very pleased to see it. The government, when they rejected the NDP amendment, it was probably because they didn't want to give the official opposition some type of win, as modest as that could be, but simply we were trying to improve legislation that actually would have improved the quality of service for our seniors. By doing that, they delayed this service, this enhanced service around dementia care for over 3 years. They created loopholes for bad operators for those additional 3 years. And it's actually, I would say, they were cruel and callous by not supporting the bill when the amendments were first tabled. That 3-year delay caused heartbreak and suffering, and that was not necessary. I think we need to think about, Speaker, how do we work together to support Ontarians, because that's what Ontarians expect. They don't really want this politicking, because isn't it silly, Speaker, that 3 years later the government is now seeing the light that they want to do what's right? Ontarians deserve high-quality care for our seniors and loved ones. That's something that we should be working day in and day out to strive for. Our seniors certainly do deserve that. Schedule 1 also, Speaker, requires long-term care operators to have programs to meet the cultural, linguistic, religious, and spiritual needs of residents. This is supportable and certainly commendable. However, Speaker, it should also be noted that it doesn't necessarily create additional facilities or create expanded maintenance to have those programs. All it does is say that there should be some programs. What we need to do, Speaker, is actually expand those programs and make sure that we can have the beds for seniors and those who require it. For example, the Yihong Geriatric Center, founded by the esteemed leader within the Chinese-Canadian community, Dr. Joseph Wong, now operates one of the largest nonprofit long-term care facilities. They've been operating now since 1999, 30 years in action, but they were the ones that led that conversation, pushing for culturally appropriate care, linguistically appropriate care for Chinese and other Asian seniors. They now operate over 805 long-term care beds, and they serve over 15,000 residents in the GTA every single year. That was the community leading the charge for this. But does every community, every ethno-cultural group have to fundraise on their own, have to demand for respect, have to ask government to meet them where they are? Or should it become the status quo that this is how you do business, this is how we deliver care? And I'll give you another example, Speaker. In Toronto Summer, we have a gem. This gem is called the Rainbow Wing inside the Rakai Center. It's a long-term care senior home. I had the honor of attending the opening of the Rainbow Wing, which focuses on providing care for the 2S LGBTQ elderly community. It's a nonprofit facility, and it provides spaces for inclusivity for our queer seniors to thrive, so they don't have to go back into the closet when they have to require support as an elderly person. This is the first dedicated 2S LGBT long-term care home in Ontario, the first one in North America, possibly. And the Rainbow Wing only has 25 beds, Speaker, in all of Ontario, when this should be a model of care for many communities. And I would argue, Speaker, that every community has 2S LGBTQ people, and every community should allow them to age gracefully with dignity in the appropriate care spaces that they need. My constituents in the Rainbow Wing have lived a hard life. It has become harder as they get elderly. They have had to survive periods of time of extended homophobia and transphobia. Many of them do not have adult children to check in on them, and they really rely on the Rainbow Wing. But Speaker, again, it's only 25 beds. But Speaker, you don't have to take it from me. You can take it from a psychology instructor from the University of Ottawa, Arne Stitchcombe, who does research on health and aging. And they quote in a TVO article that there is evidence suggesting the fears of homophobia and transphobia within formal care, which prevents healthcare utilization, timely diagnosis, and treatment of major health conditions and treatment adherence among older LGBTQS+ people. Providing inclusive and safe environments for those LGBTQ seniors is essential. Speaker, there's only 25 beds dedicated in Ontario to this community. And, Speaker, for all the government's grand announcements, I don't hear them talking about expanding facilities for the 2S LGBTQ community, despite our size. Speaker, in the final days when loved ones are scared, no one should be forced to go back into the closet. The second point I want to point out, Speaker, in this bill is the language around the importance of language communities to care. My grandmother passed away in Fudger House, which is a long-term care facility run by the City of Toronto, right on Sherbourne Avenue, Sherbourne Street. They provided a level of care for my grandmother, who spoke a rural dialect called Toisan. And although they had best intentions, it was very hard for them to deliver that quality of care. And Speaker, there are others, like my grandmother, who are now aging in Ontario. We need to ensure that Ontario facilities and programs delivered by the government is going to be accessible in every single way. Translating complex health care terms into Arabic, French, Bengali, Cantonese, Mandarin, Spanish, Portuguese, Hindi, Urdu, Tamil, Tagalog, Sinhalese, Somali, Swahili. These are the things that we will need to do as we pride ourselves on being the most diverse province in Canada. So it's not just a brochure here or there that's translated. It's about embedding equity and accessibility and inclusion into the daily deliverance of these programs, something we should all be working together to strive for, because our seniors are worth it. It's certainly nice to know that this government wants long-term care homes to be culturally accommodating, but you can't necessarily do that without adequate funding. because it does require that type of investment. A friend of mine just moved her mother into a long-term care facility after their husband had passed away. It was a difficult choice. That mother transitioned smoothly because of the home that she moved into was full of Italian speakers. She instantly felt comfortable. She was able to speak her native language with staff and residents and bond over cultural activities. And a few of her friends already live there. This is the type of long-term care experience that I hope that every Ontarian will have access to. And this is something that we should all be striving towards. And that happens with adequate investments in long-term care homes and services. Schedule 2, Speaker, amends the Retirement Home Residents' Bill of Rights. And this means that a resident's right to ongoing support from caregivers in retirement homes. Again, this is something that the Ontario NDP had advocated for in the 2021 Fixing Long-Term Care Act when it was tabled. I've heard, Speaker, countless stories about family members who are being locked away and prevented from seeing their loved ones, let alone providing them with care. And it's unfortunate, Speaker, because these stories are heartbreaking, and I suspect that you, Speaker, other members in this House have had similar experiences, or they certainly know others who have had those experiences. And that's suffering within families when they cannot ensure that their loved ones, their elderly loved ones, have the dignity of care is regrettable. But again, it's something that could have happened much sooner if this government listened and worked with the opposition to pick this up 2-3 years ago. Schedule 2 also allows a litany of government officials, including the Associate Deputy Minister and Associate Deputy Minister, Director in the Ministry of Long-Term Care, to give direction and recommendations to the prevention and management of infectious diseases. Speaker, I note that not a single one of those listed officials are required to be public health experts. They are ministry bureaucrats. Now, if they happen to have public health expertise, that's a bonus, but regrettably, it's not required. It is prudent for this government to entrust a job like that to someone who has public health experience, or at least require them to issue those directives in consultation with public health experts. Speaker, I have no idea why the government worded it in such a way. I hope that they can take caution right now, listen to the suggestion of the official opposition, and amend it, because we know that it would really make a difference when you put a public health lens over policy direction that has health impacts. What's missing, Speaker, from this bill is that it doesn't have any language that distinguishes between for-profit and non-profit long-term care homes. And we've seen that Ontario has failed to meet its own legislative targets this past year for the number of hands-on hours of care that long-term care residents receive. There is nothing in this bill to address the staffing shortages and to improve the hours of care. The government's own record shows us that as of this year, there's a need for 13,200 additional nurses and over 37,700 personal support workers in Ontario alone. That number is only going to grow because of the exacerbations and the harm done by the government's Bill 124 that drove thousands and thousands of nurses and public support workers out of the sector. That staff, Speaker, is what the sector desperately needs in order for the system to work efficiently. This bill also does nothing, Speaker, absolutely nothing to improve the pay or their working conditions for the PSWs, the nurses, and other home care workers. Speaker, we know that the working conditions are tough and that job satisfaction levels are low, and it directly contributes to the quality of care that our loved ones receive. The hardworking PSWs in this province, Speaker, and I will say this because they have said it to us many times, but it's worth repeating. The hardworking PSWs in this province are exploited, underpaid, and overworked. What needs to be repeated again in this House is that many of the PSW workers are immigrants and racialized women. The level of exploitation of these workers is grossly unacceptable. They have worked on the front lines of the pandemic, putting their own lives at risk when everybody else was safely at home. They went out and cared for our vulnerable populations when we did not. And Speaker, we called them heroes during the pandemic, and look how they are being treated again years later. I recently spoke with Connie, a PSW in Toronto Centre. She's worked throughout the pandemic caring for seniors. Her hours fluctuate significantly, and she doesn't have benefits. Sometimes she's scheduled to work as few as 3 hours a day on low wages, Speaker, under hard conditions. No one in this room, in the chamber, Speaker, would work under those conditions or be agreeable to substandard wages. So why on earth would we put them through that? PSWs are essential. They deserve to be treated with respect. Connie told me that the seniors that she visits depends on her. She is allotted 1 hour per visit to complete the following: help her client and patient get to the bathroom, bathe them, dress them, all within 1 hour. It is impossible, Speaker, to rush that kind of care in an hour, including the fact that she has to get there through the heavy traffic, take a breath before she steps into the space to provide that care. But this is exactly what we're doing to our seniors and the individuals who support them. Language and talk about supporting seniors without adequate investments and the right legislation to support them is absolutely meaningless. You can cut red ribbons all you want when it comes to opening up new facilities, but if you can't staff them, it's not very helpful at all. This government needs to step up and pay our PSWs and recognize that the work is difficult, physically challenging, emotionally challenging. I heard from another PSW in my riding. Her name is Sue. She completed her training at the height of the pandemic. She says, "I certainly don't do it for the money." She recognizes that her hard work is not being compensated, but she cares about the seniors. She believes it's a calling, and that's why she does it. This government should not be exploiting those caring professionals in any way. And it's up to us, Speaker, to correct that. And this legislation that's before us, this particular bill, Government Bill 235, has an opportunity to fix that. But unfortunately, there is nothing in the bill that is addressing it. Speaker, yesterday I had a party for the seniors who live in Toronto Centre, and it was attended by 250 people or so. It was a wonderful experience to see those seniors come together, but how challenging it is when they tell me what they are going through. And many of them fear that when it's time for them to go into the long-term care homes, is that they will not get the quality of care that they have right now while they can live independently.